My name is Miriam Mutebi, and I'm the president of the African Organization for Research and Training in Cancer. So when we talk about cancer, we're really talking about more than 150 different types of cancer. Is an umbrella term for the different types of any body types can potentially have cancer. So when we talk about early detection, we're really trying to look at what are the high burden cancers in Africa, and these are breast cancer, cervical cancer, prostate cancer, colorectal, and esophageal and gastrointestinal, which are tumors of the intestine. And if we look at early detection, what we know is that unfortunately in many parts of Africa, despite we've had a couple of efforts at improvement, but the majority of our patients are still getting diagnosed with advanced disease and often do not complete their care. If we look at the reasons behind this, we see a constellation of factors. One, the fact that patients have to pay out of pocket in order for them to access care, which usually results in financial toxicity and sometimes what we call catastrophic health expenditure. Patients are not actually able to continue their care. The second big bucket we see is what we call health systems barriers, where we know that patients are seeing on average 4 to 6 healthcare providers before definitive diagnosis of their cancer is made, which is really an opportunity for us to strengthen health systems, and really because the primary healthcare providers are the gatekeepers to care, ensuring that once patients are able to get into care, they are actually able to go along their entire treatment journey. The other broad barrier to care is what we call sociocultural barriers. There's still a lot of stigma around cancer diagnosis. People are reluctant to disclose their diagnosis, or you may find things like collectivism. We say in Africa, our strength is community. But sometimes community can work against the patient, where we're making decisions that are not in the patient's best interest, like maybe go and use alternative therapies, do not seek care. And again, really looking at the role of support that we provide to our patients is really key. Now, what we know is that many cancers, if detected early, are potentially treatable, and not only treatable, are potentially curable. And so the high burden cancers like breast and prostate cancer and cervical cancer are actually amenable to early detection. Even things like colorectal cancers can all be detected early. It really just depends on the strategies that are employed. If we look at breast cancer, for instance, which is the most commonly diagnosed cancer on the continent affecting our women, and what's I think unique to Africa is that we find that we have our patients tend to be diagnosed early, where you find that we tend to be diagnosed due to 10 to 15 years younger than the counterparts in the West. So you find our average age of diagnosis is anywhere between 40 to 55, but then at least 40% of our patients are under 40, meaning you're actually getting, and most of them are in the reproductive period, meaning we're getting them at their most active, and both from a family perspective and an economic perspective. What we do know is that majority of our women are still not completing their care due to the number of factors that we've highlighted. But if we look at the counter in the West, where we look at the 5-year survival, we know that the overall survival of breast cancers is about 90% because they are detected early, as opposed to the reverse in Africa, where we see very high mortality rates just because we're not able to pick them up early. So what can we do as a public towards, what can we do as researchers and the health workforce is really increasing awareness amongst the community, but ensuring that what we try to do is, again, community engagement, which involves one, letting patients learn about, and the communities actually know about common signs and symptoms of cancers and their detection. But also ensuring that, yes, once I pick up something, the system should be ready to, help the lady detect her cancer and refer her to the appropriate treatment in a timely fashion. So that's really the thrust of what we're hoping to do. And from a policy level, we have to create an enabling environment that's actually able to support the costs of care and treatment to ensure that our patients are able to complete their treatment journeys.
The causes?
It's difficult to say what causes cancer. That's a question that we usually get asked by many patients. Is it something I did? Is it something I didn't do? The reality is that nobody really knows what causes cancer. There are some associations. For instance, certain viruses like human papilloma virus may be associated with certain types of cancers like cervical and oral and head and neck cancers. But even then, what you find is many people are exposed to the virus, but very few people go on and progress to a cancer. So what causes that switch is really the basis of ongoing research, not just in Africa, but globally. What causes the cancer? But what we do know is that there are certain things that can increase your risk of cancer, right? But the important thing to know about cancer is not having a risk doesn't mean you won't get a cancer. But having a risk doesn't mean that you'll get a cancer either, right? So one of the things that we do know, there are what we call modifiable and non-modifiable risk factors that you can change and those that you can't. And these vary from cancer to cancer. But what we do know generally in terms of decreasing your risk for cancer, because you might not be able to remove it, but what can I do as an individual to reduce my risk is one, the two things that make a huge difference are diet and exercise. Am I able to, eat healthy, have a balanced diet? Oh, sorry. I thought you were asking a question. Are you able to eat, have a balanced diet? Are you able to exercise regularly? And some people think, oh, do I need to go to the gym? No, I mean, just the fact that you're able to walk, and there are simple ways that you can ensure that you're mitigating your risk. One of the other ways that you can look at is in terms of reducing the risk is from an environmental exposure. Things like smoking, tobacco, alcohol, all do actually have an implication on increasing your risk. We know things like obesity as well do increase your risk. There are other risks that can be in the environment, like maybe in your exposure to certain toxins or certain chemicals can increase your risk. Again, infections, as we've said, may increase your risk, like the human papilloma virus, and that's why there's a lot of campaigns around providing immunization to both our young ladies and gentlemen to mitigate the risks of those.